Hi, I'm Dr. Ron Miller of Pursuit Physical Therapy, and we had an interesting case come in, and they asked us, can Shockwave help heal fractures? Okay, so that could be a stress fracture. It could be a fracture of a bone from an acute injury. It could also be a non-healing fracture. And they wanted to ask us, and I was like, you know what? That's a great question that I could create another video on. Instead of me standing in front of the camera, we're just going to talk in like a PowerPoint presentation so I can show you some of the literature to show you that shockwave can or cannot heal fractures. So let's get started. So this great study in 2015 said has been proven to be effective as surgical procedures, but being more economic and practically free of side effects, and should be considered progressively as the therapy of first choice for the treatment of suitable non-union fractures. That's a huge statement there because most times people see a fracture and they rush into surgery. And this is a perfect example right here on the picture on the right where it was a non-union. Obviously, this is an ankle major fracture site here. Major surgery happened, and they were able to do shockwave to it and helped promote bone growth to it, even though it wasn't healing before. And this study by Shaden et al. In 2015 showed it could be an effective as surgical procedures. So that's a great study that shows that shockwave can help heal bone or heal bone tissue. So how does it actually work? Not to get into all this type of cellular osteoclast and osteoblast activity and stuff like that, but this is on a cellular level. When you do shockwave to the bone, by day 4, the inflammatory process and extracellular matrix starts to break down. By day 4 to 14, you get angiogenesis and like a lot of collagen synthesis occurring. By day 21, you have bone mineral content and bone mineral density starts to build. So bone starts to form by day 21. And then you also get a gradual increase in collagen synthesis, fibers, and all sorts of growth factors. I'm not going to go into all that, all the dorky stuff that you guys don't need to know about. But the point is that from shockwave, you're going to have all sorts of stuff happening. You're going to have an increase in osteogenesis. Just to keep it simple, genesis is the formation of, and osteo is bone. So shockwave can lead to an increase in osteogenesis or the formation of new bone. Um, and in bone marrow stromal cells or stem cells, the study in 2013 even showed a differentiate in, stem cells within the bone that actually increased with shockwave. Okay, there was an increase, and I'm not going to go over all the crazy hormones or the signals and the biochemical point of this, but it showed that, shockwave was able to increase bone marrow stem cells by implementing shockwave. And it went into further detail as zero point 0.2 millijoules is the most effective application. Normally, whenever we start out with shockwave, we're using 0.07 and we increase the intensity over time. But zero point 0.2 is the optimal amount to help heal bone and even help heal bone stem cells. Osteogenesis, again, is just the formation of bone. Another great study in 2009, this was a case series. So they looked at 10 high performing athletes with tibial metatarsal stress fractures and looked at 3 to 4 sessions of shockwave treatments. Okay, now this is dealing with stress fractures, not a full blown fracture or a non union fracture. This is a stress fracture in athletes. 100% of them healed after 8 weeks of treatment, and all of the patients returned to competitive levels. That's great. We can expedite the healing process through shockwave. You don't have to just sit there and wait or be immobilized in a boot anymore, that we could actually heal faster. So the general consensus in Lille 2015 showed the best results have been attained using 1 or 2 sessions of minimum of 2,000 shocks. Again, it supports literature. 0.2 millijoules is what we need. Again, I'm just trying to keep it simple. The point of this is that shockwave can help heal stress fractures. Next thing is about the big one is the non-union fractures. Zhu et al. In 2009 looked at treatment following a femur or tibia fracture, humerus fractures, radius, and ulnar fractures, and it looked over the intensities and the duration of treatments. The point is that 75% of these patients experienced a bony union at 6 months. These types of cases are going to actually take a lot longer to heal because the bone's not actually together. It's a non-union fracture. But even at 6 months, it showed that the bone started to heal. So the preliminary research shows that Shockwave can heal bone. Okay. Now, whether it's a stress fracture, a normal fracture, or a non-union fracture, everything's going to be customized and different for like everyone else in every case. But the point is that Shockwave can heal. And again, instead of just dealing with, oh, I have a fracture, I have a stress fracture, I have to be immobilized for 8 to 12 weeks, and I can't do anything anymore. The question is, can we heal the bone faster? Can we do shockwave interventions and help heal that bone faster? And the research says yes. So I believe the combination of PT plus shockwave will expedite this process. And if you really want to get innovative, you can even add in stem cells, PRP, or even peptides and see if you can even heal the bone even faster. But in that case, you're going to need a physician to get on board to be able to do that. But at our clinic, if you're struggling with a fracture or you get diagnosed with a fracture, but you don't want to just sit around and wait, we can get started with physiotherapy, address the impairments, add on the shockwave also to be able to help expedite that healing process. And maybe instead of 12 weeks, you're better in 8 weeks, or you're better in 6 weeks, and you're back to training and running again and stuff like that. So the research is there. It shows that shockwave can help heal fractures. And if you're struggling with a fracture that's not healing, or you got diagnosed with a fracture, but you don't want to be in a boot for 8 to 12 weeks, you can visit our website today at pursuittherapy.com, or give us a call today if you have any questions at 407-494-8835. And thank you for tuning in.